In today's educational climate, mental health resources for students are not elective. I'm here today with Julie Hoon from Youth First to talk about resources they are providing for our local students. Thanks for joining me, Julie.
Thanks for having me.
Yeah, so Youth First is based out of Evansville, correct? But then you're starting to grow in our community.
Yes, an Indiana nonprofit that I just think is a gem. So I'm so excited to be here today to share more. We are founded in Evansville back in 1998. So we're actually over almost 28 years old, approaching the 30th anniversary, which is wild to think about. But yes, we've been serving Indiana youth for a long time. We now have 14 counties in our service footprint. Knox County is one of those counties. But it's still a neat story where Indiana homegrown, and we do a lot across, even outside the counties we serve. We're making a lot of connections. We're raising awareness about mental health, youth mental health, how important it is to support kids, and we're in the prevention lane. So it's just a really neat story. And can I share about our background?
Yes, please do. Yes.
So the founding, that's where I love to start. We were founded by Dr. Bill Wooten. He's a medical doctor. He was in addictions, working at an addiction treatment center. He had a family practice for years in Evansville, in Newburgh actually, and then he took over the Mulberry Center. It was over under Wellborn Hospital. They're not there anymore. But in the 90s, he was working at an addiction treatment center, and he was seeing more and more youth. He was seeing young people who were being admitted to him, addicted to drugs, alcohol, dropped out of school. Their life was looking pretty bleak. They usually had cut ties with family, some were already in trouble legally, just had a lot on their shoulders. And in his words, he says, I was seeing them younger and younger. He was seeing more women, and he just knew we needed to do something to prevent that. He spent a number of years researching what didn't work. Think back to the 90s when it was Your Brain on Drugs, or the bloody car crash speakers come one time and kind of shock everyone, and then you move on with your day. So he saw a lot of those tactics happening, but he really wanted prevention strategies in place. And so he looked at other communities, did a lot of research with what was happening in some of the evidence-based programs we now offer came from college research groups, and were born into existence because they worked. And he brought that to the community. He said, we need prevention. We want to reach kids when they're younger and arm them with what we call protective factors to keep them away from risky behaviors, risky areas, and to keep them away from substance use. So substance use prevention is still very much part of our mission, which is strengthening youth and families. But we know that when we are arming kids with support and healthy adults and coping strategies, we hopefully won't see them turning to the behaviors that he was seeing years ago. And that has played out. But back to the 90s, in 1998, he rallied community leaders, he rallied schools and was ringing the bell and formed a nonprofit, Youth First. He'll tell you that's the hardest thing he ever did, even harder than taking medical exams and becoming a doctor. But he founded this nonprofit that now has grown to over almost $12 million in revenue, 130 employees, and like I said, reaching 14 counties. We have this school year, we have 133 school partners. We're in K through 12 schools, so elementary, middle, high schools, public, private, charter, independent, any school we'll partner with. And that's really how our growth happens a lot, is word of mouth. Superintendents change, principals change. They knew they worked with Youth First before, they want them in the school they're in now. Right. So we're always looking at growth. The state of Indiana is a part of that too, through the Department of Mental Health and Addiction. They've helped us grow, and we have thousands and thousands of donors who support this work every year. But that's what's been happening. So now, like I said, the 14 counties, 133 school partners, when you add up the enrollment in all of those schools, that's over 55,000 students that have access to Youth First services and programs.
Wow.
So that's kind of the story of where his passion was, where our founder's passion was, prevention, arming kids. He knew that connecting with kids was pertinent in the schools. That's where they're at. So we are in the schools. We are a resource in the school building. What it looks like today is Youth First mental health professionals that are right down the hall. There's no cost to meet with a Youth First mental health professional. Right. We aren't billing insurance. That was a big thing for him too. Take away barriers to access. So you don't, because we're a nonprofit and the service is free, we've already partnered with the school to be there. And our Youth First mental health professionals are embedded. They have an office in that building, so they're very much a part of the school. Yeah, there's no insurance to bill, no copay to pay or deductible. Mom and dad don't have to leave town, take the child out of school, drive across town to an appointment. We are right there in the building. And what they're doing with children every day, it's an honor to talk about our Youth First mental health professionals. We have over 100 of them on staff. I mentioned 130 employees about is where we're at. So over 100 of them are Youth First mental health professionals.
Wow.
And they are our largest program. We do have an array of programs, so I want to talk about those. We have programs that we deliver in schools, programs we deliver in the community, programs we deliver for families. So there's a whole array of programs. But our largest program is this school-based student assistance program, where we have Youth First mental health professionals delivering what Science of Prevention says is best practice. We have a 3-tiered model, if you will. So at the top is general messaging in the building. We are there to promote mental health, to support students with healthy messaging, things like kindness and anti-vaping. Our high schools are seeing a lot of vaping right now. So our school partners are saying, hey, let's bring in strategies around anti-vape messages and teach kids that those are harmful substances in those vapes. And so a lot of kids are touched, and that's all they need is that healthy dose of messaging. The next tier down is a selective tier of a group approach. We do a lot of group work. Our Youth First mental health professionals can meet with groups of students. And it's so neat when you talk to them about the different groups they have each semester. In our elementary schools, some of them are groups of young people learning how to play nicely with peers and work on social skills. In middle schools and high schools, some of our small groups are a little bit more heavier. There are grief groups. There are young people that have lost someone close to them, and the Youth First mental health professional in that school has been able to build together a group of students dealing with grief, dealing with divorce. We have some girls groups where they're journaling, they're working through feelings and emotions behind being a teenage girl. And I love that approach with group work with our young people, because it's very powerful when you teach a young person that their problems they're not alone, and they're not the only one that has those problems going on. It is so powerful you see the aha moment when they realize, oh my gosh, my peers are dealing with, someone else has just lost someone close to them too. And they can talk about that together, talk about how to get through that, what coping looks like, what a healthy behavior working through that is. So that's a really cool approach. And then I keep doing this because it's like a pyramid, that healthy messaging, that group work, and then that one-to-one support is where for sure our mental health professionals spend the majority of their time. But in all of the schools we're in, they carry a caseload of students, and they get to meet with them one-on-one on an ongoing basis all year long. So the students that are meeting with them one-on-one, parent consent is given, so that's very important. And our Youth First mental health professionals will tell you that they want to be a connector between school and home, and make sure that mom and dad or caregivers are informed about what's behaviors in school, success in school, and vice versa, that the school might know things going on at home, with what can be shared. They just want to serve as a connector, a bridge, so that the child has the best outcome for success. And they're in a school day. Maybe they're having a hard day or a tough moment or a fight with a friend. They can pop into that office and get some support and then get back to school. Or maybe it's an ongoing thing, and they're working all year long on skills and coping mechanisms and breathing techniques, or whatever that outlook is. And then last, I'll say on the one-to-one support, our Youth First mental health professionals are very connected in the community. So they are such amazing resourcers. Maybe there is more that's needed for that young person. Maybe there's a mental health referral that they can give and help the family get the services. Maybe it's some basic needs for that family: food, clothing, Christmas assistance, dental. We hear all of that. So social workers, majority of them are master's level social workers. They're just skilled at knowing how to resource and connect.
Right, right. And that's what I've seen so many local pushes about youth mental health, you know, and sometimes, and here, you know, we have Vincent's has a teen center and the library is providing more program. And sometimes, you know, it doesn't have to be, like you said, all just one-on-one intense counseling. Sometimes it's just a place to go, or having someone to just, you know, recap your day with, and just having a neutral person, right? Because sometimes home can be, you know, not a neutral place, but just having that person in the school and having it not be a teacher, which I know teachers do so much mental health work as well, you know, but just having a designated mental health worker in the school, I can imagine just gives, you know, everyone the support that they need, students and adults.
Oh, to listen, that's something, it sounds so simple, but our young people will often say, she listened to me. What did you get from your working with Youth First? Someone to listen to me. And not that mom and dad aren't listening, or that mom and dad are busy. A teacher has 25 kids in the room, but just that, sometimes that can help a child even.
Yeah.
One of our favorite data points, it's saying that one caring adult in a young person's life can truly change their whole trajectory. And you hear that when young people think back to coaches, friends, parents, who were their motivators, and oftentimes we hear that Youth First person was one of theirs.
And what an amazing thing to take home at night and
Yes,
just know that,
yes.
right?
Yeah.
Yeah, well, this is all great information, and I thank you for coming on today, Julie, and hope that people can check out and maybe learn about more Youth First services. So.
Yeah, we have our website, youthfirstinc.org, lots of programs, we have a blog with resources for parents about issues that might come up, and like I said, lots of other programs for families that they could check out.
Okay, well, thank you, Julie. To find out more information on any of these programs, like she said, you can visit their website at youthfirstinc.org.